The next video shows the 4-square model of Kirk Strosahl and Patty Robinson. This is a 2x2 table looking at behaviour as in terms of being workable or unworkable, external behaviour and internal behaviour. It uses the new acronym of CARE, so the context of the situation, the avoidance of the client or patient from aspects in their lives, the R standing for reframe, so getting them to look at the fact that they're suffering because they care so much, and then E for the experimentation, the willingness to try something new and get on with their lives. So this is the 4-square tool developed by Kirk Strosahl and Patty Robinson. And basically, so 4-square tool up there, it's all about workability. This column is what's not working, and this column is what would be more workable. Over here we've got the behaviour. So this is the public behaviour through here. So this is what the outside world can do, and this is the private world. This is what's under the skin, what the world can't see. So up here we've got the conducting the contextual interview. So this is work, love, play. And the scores here were 8, 2, 2, 5 and 3. We've got the occasional binge alcohol. We've got sleep difficulties and marijuana use to help with that. And no exercise, but there was yoga in the past. And this can be done in front of the patient or client so they can actually see their life unfolding as you are seeing it. There were no issues in terms of violence, gambling, no community links, and no spiritual connections. So this is the avoidance. A is for avoidance. And this is her flatmate. She was avoiding them. Thinking about boyfriend. You just put BF for him. Another job. She had thought about doing another job. Avoiding social engagement. And family. She was avoiding. So over on the R side here, we've got reframe and making the connection between pain and values. So that's reminding her that the psychological pain and thoughts of boyfriend go together, that you can't be caring and not have pain, and that wanting to be sociable is going to come with anxiety. And then we finally come up to this box here, was experiment with new behaviour. So she needs to be willing to trade anxiety for social success. She needs to be willing to live the life she wants to live. And she was willing to consider exercise, so doing the yoga. And then consider socialising with her flatmates. So one way of looking at this overall is to have a U-shaped pattern. So we go from here down to here and then up this side here. So we go C-A-R-E. It spells the word care. So then we would go from this point here to get her perhaps to considering doing yoga and asking her to do a likelihood out of 10 of her doing that. And again, she'd have to get a score of 7 or more out of 10. and then consider socialising with her flatmates. And again, that would have to be a 7 or more out of 10, otherwise we'd need to go back and renegotiate it. Just to elaborate on this point here, trading anxiety for success, we're not getting rid of the anxiety and replacing it with success. It's just that if this client wants to be successful, she needs to know there's going to be some anxiety associated with that. So this is really just shorthand for reminding us that anxiety will come when we're trying to achieve the things that are important for us in life. So this is one way of doing a case formulation in the ACT model or in the FACT model, and it allows us to get all the information on one page, which we can use for our own purposes or present to the client. This is the choice point that was developed by Russ Harris and his colleagues, and it enables the patient to see that they have a choice about their life and their situation. And so we have situations, thoughts and feelings down here and the choice point. And away moves is when the patient or client is moving away from their values, and then there's towards moves which are in sync with their values. So in Sarah's case, over here would be avoiding flatmates, avoiding thinking of boyfriend, avoiding social engagements, and avoiding her family. So in terms of getting her unhooked, you may wish to talk about what are the things that she could do that would take her towards these things. And one of them would be going to yoga classes. So over here it would be not exercising. And it just reminds the client that they actually do have a choice about these things, that life doesn't need to necessarily control them. And this could be socialising with her flatmates. These can work very well when a client has a drug or alcohol problem. They can look at the benefits and harms they're getting from taking the drugs and alcohol, and the benefits and harms of not having drugs and alcohol. So it's a very useful pictorial tool to use with patients to help them in that choice and making changes in their life.